In this study, we report the results of an internally funded phase 3 single-blinded factorial design trial randomizing patients 1-to-1 to receive Exparel or liposomal bupivacaine plus 0.25% bupivacaine versus 0.25% bupivacaine alone. And this was during ambulatory pediatric urology procedures. Patients were cross-randomized on procedure type to 2 regional block techniques. All of them were discharged home with Tylenol and Motrin, and then each was given a rescue opioid prescription only as needed. Our study was powered to the primary endpoint, which was the proportion of patients requiring no opioids through 48 hours postoperatively. We had 102 patients in total, 51 in each arm, that were enrolled with no differences in patient demographics or periprocedural characteristics. For our primary endpoint, we found no difference in the 48-hour opioid-free rate between groups at 61% in both arms. The experimental arm had improved parents' postoperative pain metrics at 48 hours, but there was no difference in opioid utilization or numerical pain scores at either time point. The medication was safe, no major anesthetic or procedural complications were observed. So in summary, this prospective randomized trial is the first to evaluate liposomal bupivacaine or Exparel in pediatric patients undergoing ambulatory urologic surgery. At our interim analysis, the study met its futility threshold and was stopped. And we provide strong evidence that, albeit safe, with mild short-term improvements in validated pain metrics, the addition of Exparel to 0.25% bupivacaine did not significantly reduce opioid utilization or improve opioid-free rate at 48 hours postoperatively. The reason that we performed this study was to look at whether or not this medication would be, really a game changer in terms of improving pain scores after these types of procedures. Most of them are outpatient. Most of them can be done without the use of opioid medication. And we simply included that as a rescue in case this regimen was not effective. I think that this is helpful, and even though it was a negative trial, it tells us that this medication, which is quite expensive, is no better than the $5 medication that we currently use as standard of care.